Can we have a quick summary of what is known of COVID-19 so far? Prof. Leo, could I ask you to tell us what is known of the virus, how it affects people, and do we know why some people get it worse than others?
I think first of all, I think most of us would know that this is a very new form of coronavirus. Simply put it, you can call it brother or cousins of the other coronavirus, including the SARS coronavirus. Right. So it shares a little bit of characteristic, and yet it's not exactly the same because genetically it's diverse so much that you don't expect them to be exactly the same. So what had happened is that this very new form of coronavirus now become with the ability to infect human, and this is why we are seeing a lot of human infections. And we also know today that these conditions, we can have human-to-human transmission. It can pass on from one infected person to another person. And one of the points I want to stress here is because it is a very new form of virus, and therefore the entire population, we have no immunity against it. So basically, every one of us is susceptible, and therefore the disease can spread easily because we have a very wide open, susceptible populations.
But why do some people get it more, why are they more sick than others? Some seem to get it very mildly, others end up very seriously, critically ill in fact.
Right, so this is also one of the difference that we see comparing this COVID-19 with SARS that we knew before. For SARS, majority of our patients, they became very ill. But for this new form of coronavirus, it has a very wide spectrum of clinical manifestations, from totally asymptomatic, very mild disease, to a small spectrum of individuals that can become very severe, that require ICU, intensive care, require mechanical ventilations. Now, who would be the worst hit of all those? Essentially, if you look at the demographic, it tends to be older individuals, those in the 60s, 70s, those with chronic conditions. But at the same time, we are also seeing some younger individuals without any comorbidities that can become very ill. And this is part of it that we need to continue to study as to the reason why certain individuals got it more worse than other individuals.
So you're saying we don't really know right now?
We know some part, but we don't know all.
Right. Could I turn to Prof. Mark? You've been giving medical advice to the Multi-Ministry Task Force. Can you give us a wrap of what Singapore is doing and how effective it has been so far?
Yes, we've been doing actually quite a number of things. We put in place various different components of our health response to manage and combat this particular outbreak. It starts off first in primary care, where we've activated a network of more than 900 primary care clinics, what we call public health preparedness clinics or PHPCs, where the doctors in fact are given additional resources. They've been trained, and they are very vigilant in looking out for patients who might either fulfill a suspect case definition or in fact have any suspicious symptoms that make them suspect the possibility of COVID-19 infection to be present. They refer these patients on then to our hospitals, and that includes both our public hospitals as well as the National Centre for Infectious Diseases, NCID, where these patients then are tested to look out for that particular infection. If they are infected, then they are admitted into the hospital for treatment, and they are often at this time looked after in isolation rooms to prevent any further spread to other patients and other members of public. They are not discharged until we're very happy that they've fully recovered from their illness, and they've tested and they've been tested to make sure that they're not able to further spread any further virus, in other words, not to spread any further infection. This response mechanism is also supported by many people on the back end. These people are contact tracers, investigators, who would look at every individual case that comes on to try and understand how he or she might have got infected. Then they will chase down to see who he or she might have been exposed to, who he or she had come into contact with. And the idea really was then to take a very close look at all close contacts of that particular person to determine whether they themselves are having any symptoms that might suggest that they too are infected.
Has this actually stopped too many people getting it because we are doing our quarantine, because you are doing contact tracing? Has it?
Yes, by and large, our attempts at isolating, ring fencing, and sort of preventing further spread has been quite successful, and there have been a number of cases where we've seen, in fact, an infection occurring in a particular person. Even though we're now coming, there may have been some limited spread to other people, perhaps within the same household or within the same work environment. but in fact, it doesn't spread beyond that. So our attempts at trying to ring fence and contain this so far have been quite successful.
Very good. Thank you very much. Prof. Pang, could you give us a more global perspective? What's happening with COVID-19 worldwide?
Well, obviously, as most people know, there has been a very rapid, almost unprecedented spread of the virus globally. Now it's in more than 100 countries, basically. We've seen limited introduction to parts of Africa, Latin America, and worryingly, India more recently. I think the latest figure is they've got reported 35 cases, and even as far south as Australia. And as many of you know, Italy has now even overtaken South Korea as the most number of cases outside of China. Although South Korea, at least from what I've seen more recently, there seems to be a little bit of a slowing down. But the main worry is if there is introduction and spread in parts of the world where health systems may not be able to cope with a surge in cases, importantly severe cases. So we're talking about sub-Saharan Africa, we're talking about India. So I think from a global perspective, we really hope that those two regions can contain the virus early on.
You mentioned India twice. You said that it was worrying that India had about 30 odd cases. Why is that worrying? Because there are so few, or that they have cases at all?
Worrying that they have cases at all, and it, you know, in relation to what Kenneth said earlier, their capacity to contain it very early on, because it's all about speed of containment at the early stages. And if they don't have that capacity, and if it spreads in the way that has been seen in other countries, their healthcare system may not be able to cope, especially with the sudden surge of severe cases that Yusin mentioned earlier. Do they have enough ventilators? Do they have enough medical supplies? Do they have enough protective equipment for the healthcare workers? Right. Those kind of issues.